At the outset, I would like to thank Umesh Khanna sir and Mumbai Candy Foundation for giving me this opportunity. So my task today is to give you a brief idea regarding where all can you apply for a fellowship. Most important question which people ask me, do you need to give an exam for a fellowship? Are these fellowship options funded or sponsored? And after my talk, Dr. Biani's talk is there and the panel discussion. Hopefully all your doubts should be clarified with that. I think we all are, at some stage of our life, we have this question in our minds, and the morning session, the earlier sessions gave us a great idea, like should you join a corporate hospital, continue in a government hospital, join a group practice or private practice? Or should you start considering going out for a fellowship or go, permanently also in the long run? So what are the advantages of an international fellowship? Most important is the experience. And this is what my boss, Dr. Vishwanath Billa, he told me, go there, even if it's for 1 or 2 years, in the long run, go there for the experience. Your perspective to change things changes. The clinical exposure is obviously going to be different than what you see in an Indian scenario. The patient exposure is also different. Most of the people who work there, they know it's a patient-centric approach. You need to give them all options, like unlike over here where we guide our treatment for the patients. You can develop niche areas of interest like, onconephrology, home dialysis, which you don't encounter much in the Indian scenario. It's not only nephrology. When you work there, you're going to interact with other subspecialties. You learn from them as well. And as Dr. Soni was saying, they use evidence-based medicine. They will not use, in my experience. Work-life balance. We have a whole talk on this by Dr. Urmila and Madam in the evening. But this is a right place. You can have a work-life balance when you go out for international fellowship. You have time for family, you time for doing your hobbies, extracurricular activities. It also gives you opportunities to choose alternate career paths. You may go there as a fellow and you probably get a research position. You can always think of taking up the research position. If you are a person who likes to travel, I personally like to travel, so it's a great time, go there 2 years, it's a great time to explore. Research opportunities, as I said. Leadership role. We've got lots of leaders in this room. Madam is there. So it will, help you to build a leader in your career ahead. And definitely, I went at the time when COVID was there. So the cost of living had actually come down. So, and both I and my partner, we were, earning. So you could save a little bit of money. You also get these opportunities to do these extra paid calls on the weekend, and they pay you pretty handsomely for these calls. And we had a conversation on a group last week on our Toronto Fellow group, and Dr. Georgie Biram sir beautifully quoted this. You go there for a educationally, socially, and a culturally uplifting experience. What are the limitations and shortcomings? The application process is very long. You generally need to apply 6 months to 1 year in advance. And even after that, the visa uncertainties are always there. Lag in practice. And as we were discussing, every year a good number of nephrologists are passing out. If you're going to come back to the country, you are going to expect a reasonable amount of people who've started practice, and this always then creates a, am I not good enough in spite of working abroad? Why I'm not getting a good job opportunity? Your wife or your children, if you're married, may not always get a visa, and they may not even get a fellowship. So, you may end up staying away from your family for a good amount of time. And as I said, if you come back to a tier 1 city, it does not always guarantee you a good job. If you're going to a tier 2 or tier 3 city, definitely, it is a good option there. Applicability, I feel sometimes things you learn over there may not be applicable, but most of the times you can, use whatever you learned over there. And adaptability. Once you go there for 2 to 3 years, you don't want to come back. That's a big issue. And when you come back, it's always you're constantly thinking, should I have stayed there? Should I have, done more to stay there and, do something else? If you go there for a dedicated program like, onconephrology or transplant, when you come back home, you will need to work as a nephrologist who's the jack of trades and not master of none. So going there for a dedicated program, I don't personally feel it is a great benefit when you come back to India. Where all you can apply? North America, there's US, Canada. Dr. Biani is there, he can probably give us more insights. UK is also an option, Australia, and there are some interventional nephrology fellowships at Singapore, Seoul, Mexico. This is in general. The Canadian process is the easiest to get. No exams. That's the biggest advantage. You can go there directly. I'll come to the process later on. You may even get away with the English proficiency test. USA, US MLE is a must. You cannot go to USA for a clinical fellowship without giving US MLE. And again, you will need an English exam, a TOEFL, a IELTS. For UK, you need a GMC registration. Again, you need a IELTS or OAT. The Australian process is very complex. It's very time consuming. I'll come to it in a bit. And ISN, International Society of Fellowship, depends upon the country which you're going for your fellowship. This is something which you need to keep in mind. Fellowship does not give you a consultancy or job. For example, if you're going to Canada, don't have that point like, you're doing the fellowship, you'll get a job there. Rarely, I know someone who recently got a position, but you will always be in the, the smaller cities or in the, cities where there are areas of need. It is difficult, but not impossible. Most of the times you end up doing residency. That is not only nephrology residency. You have to do the medicine training as well. You have to stay there for a reasonable more amount of time before you get something permanent in the long run. But there are always some or the other loopholes in systems in US and Canada as well. How do you apply for a fellowship? Reach out to the program director or the coordinator. The Canadian process generally requires you to, send your resume, statement of purpose, 3 reference letters from your mentors in India. Following that, they have a video interview. Once selected, you have to fulfill these requirements. The university requirement, the licensing body. For example, if you're going to Canada, it's the CPSO. If you're going to UK, it's the GMC registration and the visa formalities. As I said, entire process takes long. In general, this process remains same for all the countries. Which city and how do I reach out to program directors? Toronto and Ottawa have the highest number of Indian alumni who've gone there, trained there and come back. Hence, I think everyone is much more comfortable applying there. Plus, both our program directors are Indians. Dr. Tushar Malvade was a alumni of Nadiad, and now he's just become the program director. It's always easy to reach out to them, and they very promptly reply your emails. Vancouver, Calgary, and Edmonton are other cities where you can think of applying for a fellowship. Which fellowship should you apply? So Toronto is very clear. They expect you to do a general nephrology fellowship for 2 years. Unless you do that, they won't give you any of the subspecialty fellowships. However, like you can, once you're completing your 1 year of fellowship, they will always ask you, are you interested in doing a subspecialty fellowship? You can ask them if there is an opportunity available. They'll probably give you one of these. But you will have to complete the general nephrology fellowship eventually and then come back. The subspecialty fellowship which they offer are transplant, onconephrology, home dialysis. They've recently started this POCUS fellowship, critical care and glomerular disease fellowship. There's a new fellowship which has come up, and they're actually looking out for people. Earlier, this fellowship was only restricted to Canadian PR holders and people who are Canadian students, but now they've extended it. So they have 2 positions. Always, you can write to Dr. Darren Ewan. He'll reply for it, sure. Ottawa also has kind of the same process, general nephrology fellowship for first year. But if you're lucky enough, you may get, one of these subspecialty fellowship. You can get a transplant fellowship and then see, how things go. Vancouver also has transplant fellowship, GN and home dialysis, and Calgary also has a transplant fellowship. So how is your life during your fellowship? You won't get any hostels. You have to rent out your own apartment. If you don't know how to cook, you learn how to cook, because you won't get any house aid over there. So I think that's a must when you're going abroad for a fellowship. Generally, they pay you pretty well, 5,000 to 5,500 Canadian dollars a month. And UK also, it's approximately kind of the same. And you can always do some extra paid calls. The weekend calls, as I was saying, work-life balance. You end up working only on 1 or 2 weekends a month. You are entitled to 20 days of paid leave. Make sure if you're going there, travel, you learn, get to explore a lot. Your posting is, or your fellowship is divided into different blocks. You work 2 months in transplant, you work 1 month in JN. So it's not like you won't get any exposure to those subspecialties. You definitely get exposure. The Canadian programs, they don't have a lot of interventional exposure. So if you're asking me if you're going to get to do biopsies or tunnel lines, you won't be able to do any of those except temp lines. That also, I would say, maximum you will get a 4 or 5 a year. And always, as I said, you can discuss with your program director what are your future goals, and they'll definitely help you out with your for the future aspects. Going to UK, as I said, GMC registration is a must. ILTA or OAT is a must. Having an ESC NEF, which most of you may apply for, does not give you a GMC registration. You can always look for jobs at nhs.jobs.uk and track jobs. The jobs you're looking for is a clinical fellow job or a renal registrar job. How do you apply for a GMC registration? 3 routes. First is PLAB. It's a licensing exam like USMLE. It is not a degree. Step 1, you can give it in India. Step 2, you have to go and give it in UK. MRCP is a degree as well. 3 steps. First 2 are your written exams. MRC PACES is an OSCE. Generally it takes 1.5 to 2 years to give it because you're not getting slots for the OSCE exam. And last is this new initiative which is they call as Medical Training Initiative or MTI. It's neither a degree or a license exam. The Royal College will sponsor your GMC registration, and the maximum duration you can stay there is for 2 years. But once you go there, you can probably give your MRCP, and if you want to stay there for long term, this is a good career choice. Requirement for MTI also is not much. Most important thing is if you have any undergraduate bonds remaining, you need to clear them first, because the first thing which they will ask you is an EPIC verification of your primary degree. They don't care whether what's your nephrology degree or the MD medicine degree. They will go back to your primary degree, that's your MBBS degree. So if you have any bonds pending, just complete that, because that always goes to your primary college. You must be in active clinical practice and 3 years of experience, and that your super specialty training is definitely considered over there. And as I said, how do you find jobs? You can go on their website, reach out to program directors, reach out to friends if they're working in UK, and if they can get you in touch with certain program directors in organizations like BAPIO, which keep on holding interviews in India. USA, as I said, MLE is a must. You can get a research fellowship without doing MLE. I think there are a lot of nephrology job fellowships which are being posted, and there was a recent, I think so on Twitter also, there was a link which was going on. The number of fellowship positions are going empty. So it's a good, if you have given MLE, it's a good option. Another option is you go to Canada, prepare for MLE during your fellowship 2 years, and then apply from USA. If you get a reference from Dr. Bayani, I'm sure you'll get a good program there in US, and many people think of doing this. I had asked Dr. Jeremy Chapman, what are the scope of fellowships in Australia? He said, the number of nephrology fellowships in Australia is absolutely limited. It has a very complicated process. Even if they have a position, they would prefer giving it to an Australian citizen, and then they would consider an IMG. If you are still interested, I would suggest you reach out to some Indian nephrologists who've gone there. Dr. Basu is there, Dr. Madhi is there. They'll help you with this process. Singapore General has 3 fellowships, but unfortunately, all 3 of them are self-funded, and I don't think it's worth spending so much of money and going there. The ISN also has a lot of fellowship, and they have come up with these regional training centers, of which 4 of them are in India. So if you still want to do 1 more year of fellowship, I think so it's worth taking up in these centers. And there are a couple of fellowships in UK, the ISN Heartlands Fellowship and Kidneys for Life Fellowship. One is at Manchester Royal Infirmary. You can speak to Dr. Sandeep Mitra, who is coming there. He's at MRI, so I have his opinion. And the ISN UHN Dialysis Fellowship, which is again in Toronto, but you apply via the ISN route. These fellowships are for a period of 6 months to 12 months. They have given a good guideline on their website. Click on it, and they'll guide you through the entire process. They come with their own caveats. You need to provide a letter from your home institution that you would come back and work in your home institution, and keep sending periodic reports to them. If you don't fulfill this, they will probably you'll have to pay back the grant money back to ISN. Interventional nephrology, they've got 11 centers. These are usually for a period of 3 to 6 months. Same criteria, you have to go back to a center and apply from this thing. But I feel most of our DM and DNB programs give you a very good interventional nephrology exposure. ISPD also has a fellowship program. It's more like an observership, a period of 3 months, multiple centers throughout the worldwide. You need to be a member of ISPD and before you apply for this observership. Times are changing. We are focusing on the concept of Made in India for everything, and this is a fantastic initiative by Indian Society of Nephrology for these post-doctoral fellowship, and MKF is also coming up with this observership program. Dr. Ayan will be speaking on those. So to conclude, I would say you start early, keep your long-term goal clear. If you are very sure you're going to, come back, it's fine. But if you want to, stay there, make your career over there, start planning early. If you need to give an USMLE or give an MRCP, start preparing in your early years of nephrology. You always need to discuss with your family and partner. If your wife is unhappy or if your husband's unhappy, don't go for the fellowship. International fellowships definitely have their advantages, but have their own caveats. Job prospects after coming back may or may not be great. With that, I'll conclude, and I'll happy to take any questions.
Wonderful. Thank you so much. That was excellent. It's really important to have questions from the audience more than anything else. So I'd like to open it up. Is that okay at this point?
Absolutely.
For questions? And while all of you are thinking to get a question, I'll just make one comment. So I think that getting a different perspective is absolutely critically important. And I think that even though I sensed your diffidence in that it doesn't help you get a good job here, which hopefully will change, I think that in the long run, right, if you think out over the next 25, 30 years, the benefit of that different perspective, the contacts, the interactions, it pays it back, many times over, whether you're in a solo practice, group practice, corporate, hospital, or academia. So that's one thing I would say. And then the second thing I do want to say about the US, we are struggling in nephrology in the US. I think we have too many nephrology fellowship slots, for one. And I think that there is clearly probably a valid viewpoint amongst the internal medicine residents that with regard to work-life balance and the amount of compensation, nephrology doesn't do that well. Compensation is actually not too bad, but you have to work hard for it. And I will say that we are trying in many, many different ways to address this issue, because for ASN and for the nephrology community, it's critically important. But what that does mean is that if you've trained in nephrology in a good program here, I think you would be able to get 2 years in really a very good program there, and I think it would be a positive on both sides. So I would just put that out there, that I think there is that opportunity.
Nobody wants to go abroad. No questions from the back.
Whom should they approach, sir? If they want this, the youngsters, they're very different to go to United States because of the USMLE, the third year flex. Whom should they approach?
Yeah.
Go ahead.
Educators, that's what you're saying. As Praveen had said, that now it's no more lucre. Most of the fellowships are going up again. No one wants to take a nephrology fellowship because of the only one thing: money, money, money. If you want to earn money, then US is not the right place to do nephrology. You can change your system to MBA or something. But you see, the issue is that if you want to go abroad, now nephrologists are coming together to give you a capsule which will solve your problem, right? For your juniors as well. Suppose if someone wants to do a USMLE or do a residency and do a fellowship, there are a lot of steps involved, and that is too cumbersome unless you are very trained for that. So now the whole capsule is coming where you can, of course it comes out with the money. You can get all the steps done at a very good center, research rotations, other things, and get the fellowship as well. But nephrology fellowship, as sir has said, salary group. So America is at the top and the doctors are at the 1% of the salary, but still the nephrologists feel that money is still not coming.
Yeah, I'm just going to add once. So I agree with you. I think this is an opportunity for good people to get trained in good places and for everyone to benefit. The one thing I will say, and this goes back to the group practice discussion earlier, I think one of the things that that's not realized as much as that is in many large group practices, the work-life balance and the compensation are actually going very much in the right direction. And I think that there are things, obviously, that the whole community can do to push that forward. So I'm hopeful that, it goes up and down so that we'll be up again.
So I think we will have a continuity of the topic.
I'll just put a little comment.
So
for
just
the
to inform them
students.
that please, tea break would be after this session, so that we request you to hang on because that's going to be a very important session.
So I wanted to add, when, a personal experience. When I went abroad, I was being told by everyone that I'm trained in India from good institutes with good teachers. I am Dr. Bharat Shah's student. I had a wonderful teaching. But Dr. Vidya Acharya was the one who pushed me, saying, no, you have to go. And Dr. Bharat Shah kept asking me, why do you want to go? But Madam Acharya said, no, you have to go. And I realized when I went that yes, I had to come. It makes a difference. You are going for yourself. You are not going for a job. You are not going for anything. You are going to refine yourself. You have learned everything over here. You've been taught everything, but you have to know how to put it in perspective. You have to learn to talk to different people. You have to learn how to grow and stand for yourself. You are going from your country. You have to showcase that you have been taught well. You learn from there. You learn everything what they have to give. There are so many new things. And persevere. I have seen so many students who go there and within first 6 months they say they are homesick. What is there to be homesick? You are with patients, you are with doctors, you are grown-up doctors. There is nothing to be homesick. Persevere. Once you persevere, you will find your passion. Like Dr. Bhasin said that 2 years of nephrology fellowship is necessary. Yes, it is necessary because you will find your passion. You will understand what you want to learn. 6 months is too less for you to understand what you want to take from there and come back to your country. You have more weapons to use over here. You are equipped to do more quality care, I should say. Just because I stayed back and I decided to go into transplant fellowship, I landed up in an HLA fellowship, which is not yet existent, but I was offered it. And there I found my passion. So you have to give it time. You're going to refine yourself. So do not shy away from fellowships, saying that who is going to spend 2 years abroad? I want family time, I want money. No, those 2 years are the years where you are still in the learning phase and you will develop. I think I will stop at that comment.